Glasgow City has a population of almost 600,000 people and is one of the largest cities in Europe. Glasgow City Council receives the largest number of homelessness applications per year in Scotland, disproportionate to the size of the population. Glasgow City Council operates within the Health and Social Care Partnership, which is the integration of social work and health service provision and includes the delivery of our statutory homelessness services. In 2016-17, Glasgow received a total of 5,378 homelessness applications, with 42% of applicants reporting to having multiple and complex needs. This includes, but not limited to, problematic drug and/or alcohol use, mental health problems and repeat homelessness. Glasgow also has one of the highest reports of rough sleeping and has a population of 30 to 40 rough sleepers on any one night. There have been significant changes in the profile of social housing provision in Glasgow. By 2009, Glasgow City Council had transferred all of their housing stock to registered social landlords, with Glasgow Housing Association (GHA) receiving over 60% of this stock. The City of Glasgow has secured one of the largest city deals in the UK, and this will fund major infrastructure projects, create new jobs and assist thousands of unemployed people back to work. A regeneration area was identified, and as a result, Glasgow will be required to relocate a number of its homelessness residential services. In March 2018, Glasgow City Council sold the building which delivered Clyde Place, a 54-bedded emergency accommodation service, and was therefore required to be relocated by September 2018. The original plan for Clyde Place was to build two smaller residential services at a cost of £20 million, and this would take a number of years to be delivered. A new plan was therefore required for the 54 vulnerable men with multiple and complex needs. A decision was made to rapidly develop a Housing First project within the 6-month timescale. In addition to developing the Housing First project, the plan included the decommissioning of one and the reconfiguration of another residential service. Housing First is a well-evidenced approach and shifts services from the traditional residential provision to supporting people in their own home. It minimises the time spent in and the need for emergency accommodation and is about rapidly rehousing multiply excluded people in a community as the first rather than the last step. A small health and social care partnership project team was quickly drawn from existing resources and given the task to develop the project plan and deliver the multi-agency Housing First project. The team was then extended to include the Salvation Army to provide the Housing First support packages, the Wheatley Group to provide the 54 tenancies, and the Social Bite charity to provide financial support for furnishing tenancies which offered individuals choice. Operationalising this project meant confronting head-on the reality of developing it within tight timescales, dual planning around decommissioning a large residential service, and this required all partners working together towards a single goal, having the courage to leave their own, often long-standing organisational systems and processes at the door, and lastly, bring about a significant shift in organisational and staff culture. It required the right people around the table who would bring innovation and creative thinking, and a commitment and willingness to bring forward change. The Housing First assessment team reviewed 84 vulnerable men, with 33 men receiving a Housing First approach. This included a Scottish secure tenancy with an intensive and assertive support package. In addition, they received a choice of furnishings, essential household items and food provision for the first few weeks. What has Housing First already achieved in such a short period of time for the individual? Safe and secure accommodation, which has now been seen as not just a roof, tenancy or a house, but as their home. A reduction in harmful and risk behaviours, and the integration into local communities with a number of men already engaging in voluntary work with plans to move into employment, the re-establishment of family relationships and a stronger engagement in their own care plan.